My name is Sophia Silao, Program Officer at the NYHealth Foundation. Welcome to our webinar entitled Developing Youth Mental Health Services for Immigrant and Rural Communities on Eastern Long Island. Before we begin, I invite you to drop your name and organization in the chat and feel free to send in questions and comments. We will have some time at the end for a brief Q&A. Today's session will be recorded and closed captioning is provided. I'm joined today by Minerva Perez and John Lopez, who are tireless advocates on behalf of Latinos in Long Island. Their group, Organización Latino Americana of Eastern Long Island, or OLA for short, supports the mental health needs of middle and high school students in the easternmost section of the region. Their work is part of a broader effort to address the growing youth mental health crisis in the United States, where over 6.5 million adolescents experienced a behavioral health condition in 2022. It's an alarming statistic that prompted the U.S. Surgeon General Vivek Murthy to declare youth mental health the defining public health crisis of our time. New York State is no exception. Surveys indicate that the number of adolescents who reported feeling persistent sadness or hopelessness increased by 34% in the last decade. It's a complex issue, and despite local and statewide investment in mental health support, 42% of middle and high school students with one or more behavioral health issues did not receive care. This is especially true in communities of color and in rural and semi-rural communities. Minerva Perez has been the executive director of OLA since 2016 and oversees their varied programs, including immigration legal services, teen programming, law enforcement trainings, and medical transportation. She has a background in residential and transitional services for survivors of domestic violence and is a sought-after speaker on immigrant and women's rights and the arts. John Lopez is OLA's Youth Connect intervention advocate. He's a first-generation college student at Georgetown University, pursuing a BA in sociology with minors in government and Spanish. He combines his Mexican cultural heritage, leadership experience, and passion for wellness to enhance community outreach and support for Latino youth and families. Welcome, Minerva, and welcome, John. I'm excited to have this conversation with you today.
Thank you, Sophie.
Hi. So Minerva, let's start with you. Give us an overview of OLA and some context of why youth mental health is central to your organization's work.
Okay, thank you so much, Sophia. It's wonderful to be here. Wonderful to see all the organizations and individuals that have joined to be part of this webinar and watch the webinar. I'll speak briefly about OLA, and then whenever you'd like, I can share my screen with some more specific information on Youth Connect, our mental health initiative and program for youth and families. So I'll start with OLA, founded in 2002 as a nonprofit on the East End of Long Island as a result of growing injustices and safety concerns across our community, focused on Latino members of our community, both recent immigrants and also folks that have been here for even generations that still encounter injustices due to perceived misinformation, lack of status, immigration status, language access concerns, and therefore a much more diminished connection to some of the institutions, the very institutions that we all need out here, whether we're victims of crime, whether we are sending our children to public schools, whether our children have special needs that we cannot even access because of the lack of information or understanding or respect that many Latino parents do encounter. We are a very siloed region in this East End of Long Island, which is one half of Suffolk County. We have 10 police departments that are independent, 10 court systems that are not part of the New York unified court systems. We have 24 school districts. We have over 10 towns and village municipalities. So there's a lot to navigate. And on its best day, it can be beautiful. And on its worst day, or if you're dealing with political unrest, if you're dealing with pandemic, if you're dealing with anything, or you yourself as a family or a caregiver are experiencing a difficult time, navigating all of these institutions is absolutely overwhelming. And further, we are isolated in this region. It's a beautiful oasis for many, and for those who serve the folks out here, it can be very isolated. There is no public transportation or very minimal public transportation, and it's very difficult to get around out here. So these are some elements that kind of go into the foundation of why OLA has become so important across the 22 plus years that we've been out here and why we've grown. So Youth Connect came out as a result of tracking the mental and emotional health needs of our youth and our families. And I think maybe now's a good time to dip into the screen
Please.
share. Okay, thank you. I'll do that right now. This and share, and there we are. Okay, so just making sure I can see everything as well. So Youth Connect came out as a result. Now I'm not be able to do it. There we go. Tracking the emotional and mental health needs and lack of access that our community has seen over the years. So we've been tracking that for about a good 7-8 years now, and seeing that even young as 6-year-old members of families have been dealing with anxiety and depression. And we then put together a survey. We had over 400 responses to understand where middle and high schoolers experienced mental and emotional health challenges, if in fact they did, across the east end of Long Island, of our 24 school districts. And if so, what type of challenge were they encountering? What type of crisis? How do they handle it? Who do they speak to? Who do they wish they could have spoken to? What held them back? Because we know that our schools have social workers. Unfortunately, not most of our schools are able to have Spanish-speaking social workers, even though across our 24 school districts, and this is a very important number, we have over 50%, 50% Latino student body. That does not mean that every one of those students doesn't speak English, but it does mean there's a good chance that their parents or their caregivers or their family members that care very much for those children are not first, their language is not English as a first language. So therefore, things that matter most, and of course, education matters most to our families, education and safety. You can't talk about some of those issues, whether they be academic issues or social issues, or your child is going through depression or anxiety or potentially using self-harm. You can't have those conversations if you're not having them in Spanish with a native Spanish speaking family. So even though students may know that there are social workers and trained mental health professionals in their schools, there are reasons why they hold back. And a lot of those reasons have to do with fear. They fear that their parents are going to get in trouble. They fear that that stigma will follow them. They fear that it's going to cost money somehow. So they hold themselves back. So this 400-person survey that we took, we then analyzed and had that professionally analyzed through our university out here, Stony Brook. And little by little, we started coming to the realization that this lack of services was not going to be fulfilled by OLA simply advocating, because we do a lot of that. We advocate hard at our state level, at our county level, at our local town and village levels. We started seeing that there was one mental health provider out here that predominantly was supposed to kind of take that space, and they are not able to. So over the course of time, we've seen maybe they've had 1 or 2 Spanish-speaking mental health professionals. That is not enough to meet the needs that we have across our region for our students, most especially, and also for the families that support them. So even though we had been spending a lot of time discovering what the problems were, where the problems were, where the gaps were, we realized that advocating alone wasn't going to get us where we needed to be. What we had to do was create it ourselves. So this is where we come to Youth Connect. So we said that we will build what we can build in the appropriate way that we can build it, through guidance from Office of Mental Health, through guidance of New York State and our county and our local providers, so that we were learning and building this correctly. We'll build an answer to that, which is that students really wanted someone to talk to, someone to listen, someone to be there with them as they walk through some of the most difficult times of their lives that could be as serious and significant as considering harm to themselves, or they're dealing with academic issues that can be bundled up and start taking on more and more of a space in their head, so that they're not sleeping well, they're not eating well. So we are there for students, and this is why we have created Youth Connect, with youth at the center, as you see in this image, and the cross around the circle there, care providers, houses of faith, parents and caregivers, peers and schools. These are the 5 entities around youth that we learn through our survey that if there were a way to create better connections, trust, relationship, communication to any one of those circles, youth would be able to survive and even thrive through the most difficult circumstances. What we also found that OLA had to do, even though we are a Latino-focused organization, is we could not, in any good faith, hold back this type of life-saving and affirming and very, very important work to only our Latino youth. We realized that what we had to do was create a new system, a new offering that included all youth, whether they have money, whether they are English speakers predominantly, whether they're Spanish speakers. The two main languages spoken out here in the East End are English and Spanish. And we said, we can't hold it back. So we initiated Youth Connect for that reason, because we want to, and just to make it clear, we had to. So the impact as of this moment is, give or take, probably a little bit more than this slide. The slide was maybe maybe a month ago. But right now, well, May, right now we're at over 6,790 adolescents engaged in person or through the helpline. And our in-school work is very important to us. But we have started off this initiative by saying that we're not going to have schools be gatekeepers to our youth. So as we build out the work that we do, that John will speak about as well, is we look to other ways of engaging youth in other spaces that are not just school environments. School environments sometimes have to be pretty close to the vest. We work with every school district in slightly different ways because they want us to. And yet we're always pushing a bit of an envelope about the conversations that we can have with our middle school students and our high school students on the topic of mental and emotional health, different ways to mitigate different things such as depression, anxiety, talking about networks that students often don't have. They don't feel that they could speak to anyone about the best day they've had ever or the worst day. And these are topics and different approaches that we have in person. We have noticed, and here's one way of kind of monitoring some of the success of the work that we do, is every moment that we're in a school in front of our middle schoolers, let's say, and we don't do anything via assembly style. We don't feel that that is the right way to do this work. So we take this one classroom at a time. Oftentimes that's a health class, or sometimes a nutrition class, but oftentimes health class. So that might be 25 students at a time. So we will go into a school district and see 700 or so youth, one classroom at a time. That might take us, a couple of days to make sure that we do all that. But right after we leave that classroom, our text line go up, our requests for support. Sometimes they're testing us out a little bit. Are you a robot? Is this AI? Do you really speak Spanish? Were you the ones in the classroom? What we like to be able to show during these presentations is that the very same person doing these workshops is going to be on the other end of that line when they're texting. We also make it very, very clear to everyone that this, which is scary for a lot of adults, and you all will probably tell me why, we know why, but we still know that we have to do it that way, is we offer an anonymous option. And that anonymous option came about as a direct result of the survey that we did, where students said they do not want anyone to know sometimes what they're going through. They don't even tell their friends what they're going through. So this anonymous feature allows them to block their line and text us some of the darkest things, some of the easiest things, so they could test us out. And then they might use their own number to text us, or they might not, but we have to be there for them, absorbing and allowing us to kind of hold a space that can be uncomfortable, because we don't get to direct the result. We don't get to direct the outcome. We don't know always what the outcome is, but we know that we're there for our youth, and that is what they need. These are some examples of outreach that we do, schools, of course, and then outside of schools, different participations that we take part in. We've got a youth bureau in one of our towns that's pretty active. We've got pretty active sports programs that John can speak about as well. We've expanded out a summer camp. So last year we did 1 week of a summer camp. This year we did 2 weeks of a summer camp, and our camps are engaging, and we want to grow them. We want to grow them carefully because budget and all that. But what we're seeing is that this in-between age of pretty much like 11, 12 to about 14, 15 is an age that is difficult to find the right kinds of activities, especially during the summer, that can be educational and, more importantly, just can support sort of the emotional and social needs of our youth.
Great.
These are some of the comments and quotes that we've received back. Youth Connect counselor, you went through a traumatic experience, and this is information that can help you understand your feelings and maybe implement some coping mechanisms. Does any of this resonate with you? Yes, all of it helps because I kind of was in denial until now that I truly actually went through all of this. These are exact quotes. Do you think there's some things you can take from this? Yes. And some of these conversations go on for a while. Some of these conversations might be a 2-hour conversation, and we're there for it. That is my last slide. So I'm going to go ahead and stop that share, but that gives you kind of an overview of Youth Connect and the reason why it was started. So thank you, Sophia, and thank you,
Great.
everyone.
Thank you, Minerva. And John, you grew up in Eastern Long Island and actually came to OLA as a young person. So I wanted to hear your perspective in terms of some of the factors that come into play for young Latinos in the region when it comes to mental well-being.
Yeah, it's an interesting question. It's something that I've experienced like my entire life. So one of the biggest issues like for Latino youth, especially, for someone that I'm still kind of navigating, is just being first generation and also being born and raised in one of the wealthiest regions like in the nation. It's something that's almost a unique experience. It's something that a lot of Latino youth have experienced when they go away, when they leave the east end of Long Island, or if they go to college. You realize, wow, like a lot of the things that I've witnessed, growing up in a region where there's just billionaires, some of the wealthiest individuals like in the world that come and visit and treat it like a seasonal playground. It's pretty astonishing. I think, on top of that, it's also that being first gen means you're the first American, if not one of the first Americans, where you're like exploring everything for the first time in a place that doesn't have a lot of accessibility, especially when it comes to language. So for like immigrant youth, for example, that's probably one of the biggest issues. Minerva mentioned that one statistic of approximately 50% of the population of school districts is Latino. They're, social workers, teachers, the reflection of that culturally, linguistically isn't there. It's something that's still like developing, I feel, but that's something that, Youth Connect is kind of responding to. I think on top of that, the fact that being first gen means you also might have to deal with trauma that your immigrant parents experienced, maybe arriving to the country, or trauma that they experienced from the past. And now it's up to the first gen youth to figure it out, to sort of like confront those traumas, to confront those issues that have existed like from generation to generation, and figure out like, okay, like it stops with me. How do I figure it out?
Well, thank you for sharing that, John. In one of the conversations that we had leading up to today's session, we talked about the proud tradition of resiliency in the Latino community, but also the fact that mental health is taboo. And so you touched on that. Can you talk a little bit about how OLA creates spaces for young people to be able to address their own mental health needs and to even talk about that?
Yeah, so that's one of the cool things. So I joined recently as an intervention advocate for the Youth Connect program. So while there has been in-school presentations where the Youth Connect team and the crisis counselors are sort of like, being careful, like pushing the envelope, but still being careful to follow like whatever the schools like require, for these in-school presentations. But we're also really trying to put a lot of emphasis on outside of the classroom activities, gatherings, events, and workshops. So one thing I was able to participate in recently was the Youth Connect summer camp program. So that was a 2-week program that we did, second year in a row, a 2-week program that we committed to in July, where the first week was dedicated to exploration of the arts, and the second week was dedicated to exploration of nature and the local environment. So the first week was very exciting just because, these teens, really, youth, who all identify as Latino, some of them only Spanish speaking, some are bilingual. Everyone that was on the Youth Connect team at the time also bilingual, so we're able to speak, 2 languages simultaneously. And we were able to like actually like, develop a relationship with local artists, renowned artists, like who have pieces hanging in museums, like in the city, in the Hamptons, and being able to just walk in there and say, wow, like this is something that, they've never experienced before. This is something that their families didn't know existed. It's something that you don't really take into account because there's a chance that their families are constantly on survival mode. This Youth Connect camp was honestly a great response to the fact that immigrant parents, this is a summertime in the Hamptons. Summertime in the Hamptons is a critical time for making money. So, days on end, hours on end, these families are busy outside of the house while these children like might have to stay at home or find another summer job. But, with the first week, we were able to collaborate with a lot of local artists and just explore like different museums like that, a lot of that are honestly difficult to access. So we had sort of like the inside scoop. But my favorite part of this summer camp was the second week. So that was dedicated to environmental sciences and exploration. So one thing that I honestly took into account a lot is I've always had an appreciation for nature, right? I think everyone does. Everyone treats the Hamptons and just the East End of Long Island as a paradise. It's full of like flora and fauna that, a lot of conservation is dedicated to, a lot of farms. And it's something that people don't really think about when you think of, the Hamptons or just the East End of Long Island. So, we were able to bring children to nature preserves in collaboration with like the Peconic Land Trust, and also onto farms that have existed like for decades on the South Fork. These are just places that these children just haven't really had a chance to explore or even think about. On the last day of this summer camp, we were able to go to one nature preserve right on the bay, Northwest Harbor, actually. And we were able to experience one activity, an activity that they've never done before in their life, which was fishing. That sounds very simple. It sounds easy. It's like, okay, like, it's just fishing. It's not a big deal. For these 12 kids, I had the opportunity to teach them for the first time in their lives, like how to fish. Their parents don't have time to do that because they're working. It's the summertime, especially year round, And so for me to provide that experience for them, especially me going through that, my dad was able to teach me how to fish and also show me to have an immense amount of respect for the land, like especially the East End of Long Island. I'm first gen. A lot of these children are first gen as well. And so, it was a magical moment. Seriously, just all of them looking to me for guidance and, just something as simple as like, teaching them to skip rocks or, what kind of fish they caught. It really just like assisted with like, I think, for their mental health to be aware of like, wow, like we can bond over this and honestly treat this place as our home.
Well, thank you. Thank you, John. And Minerva, the NYHealth Foundation supports Youth Connect's work. And you had touched on this earlier, but I'd like to be able to drill down on this a little bit more in terms of how your organization is really approaching sort of mental health provision in a very systemic way and how you're working with schools and local agencies. Can you talk a little bit about that? I think you're on mute, Minerva.
My bad. Sorry about that. Thank you. To jump off of something that John said, which again does sound simple, but it's not, is more and more, we are looking and reading everything we can on what are some of the best ways to approach youth mental health. And a lot of what we know and just feel, I think naturally is that the world, this natural world that we have around us is, those spaces are important, being in woods, walking, taking the devices and putting them off to the side and having that experience in our area. I mean, a lot of folks that come here for the summer know that the problem that we have is that access to these things is really a kind of a scary thought. So if you go to some of these trails or to get to some of these waterways to even fish at, you've got to contend with probably definitely parking violations that can lead you to court. You also have to deal with fears of trespassing. I mean, I might feel at this point that I can walk and I can go down any trail where I see a little white marker, even if it is behind someone's mansion. But not everyone feels that. So there is fear that's built into the fabric of our community. If you are not part of a privileged set, and that might be because you have money, that might be because you have generations and generations, it could simply be because of the color of your skin and the language that you speak at home. That you will not feel and you will not have the same access to some of the most important things. So being out in the woods, I feel to be a really important way of dealing with mental health. But then other aspects that our children, most especially, feel the effect of, no matter what their parents or caregivers do to protect them from it. The reality is our highest numbers of wage theft are happening right now. Latinos are working and not getting paid. They are working and they're working for most of the summer, and they're working in ways that are very, very difficult. And they're pulling themselves back from going to authorities to report the fact that they're not being paid because they're fearful of that. They're fearful of retribution, of being put on a blacklist. It is the Hamptons. It's not that big of an area, but it is the area for them to work. So that very often at the end of the summer, we will have people coming to us, bringing us these claims that they have not been paid for months of work. And we have seen these claims come now in the middle and the beginning of the summer because it's that bad. So we do work with Department of Labor so that we can have an immediate address of these things, but it's taking longer and longer because we're having more and more claims out here. Whether you're documented or not, you have a right to the wages that you've earned. And at least we're able to convey that to our community, but that not having the same access to law enforcement for victim support and victim services. Law enforcement does not on any regular basis ask about immigration status, but there are things that are inferred. There are fears that are real. There are validated fears as to why people don't feel they can go to law enforcement, even to the degree of what might be happening at the DA level, what might be happening at a larger level. There are reasons to fear. We've lived through some of the worst of them. We've lived through raids. We've lived through not equal access to pandemic support during a pandemic. So our community has a very major reason to kind of fear that they have the same kind of access. Unfortunately, that kind of drills down into the children. It just does, whether it's because of physical health or mental health or just the psychological effects of this lack of access and community trauma, quite honestly. So what we do in terms of our mental health with schools and even with so right now we've been added to New York State budget to a very small degree, but we're thrilled about it because it basically is an acknowledgement that the work that we do as this relatively small nonprofit on the East End of Long Island is innovative enough. It shows the numbers and shows how we're able to do the work we're able to do to the degree that they're putting their money and their kind of stamp of approval on it. So we're super excited about that development that just happened at the recent budget. And we are working directly with New York State to make sure that any access points to funding or even other types of support, we want to make sure that policies that are related to mental health access are meaningful for our community, because there can be policies that exist in New York City that don't adequately address the needs that we have in a more rural area that's a little more isolated. We also have all of these independent towns, villages, courts, schools. So how does that play out? We have to look at the legislation that we have and the kind of the guidelines that we have in a very different way on the East End of Long Island, which requires a lot more conversation, a lot more relationship building, and digging into all of it. So that's what OLA kind of has to do. In terms of partners or mental health partners, we're still looking for that. There are organizations that are wonderful, but some of their guidelines make it more difficult for them to work with East End residents. And so we're still working on ways of how do we bridge some of those gaps, working with Suffolk County Minority Health, a wonderful office. And I think they're doing everything that they can to see what kind of bridges can be made here so that the access to regular clinical level mental health support can be increased out here in the East End of Long Island. And not just for some of those crises, but even for those crises that might result from someone wanting to harm themselves or harm others or be actively sexually assaulted. These are areas that we hold very closely in terms of immediate response. So it's an ongoing continuous development of relationship and drilling down into policy and actual procedures. So it's not just about saying, oh, this is what we do. We want to look at it and say, okay, but what have you done? Or what are we doing right now? How can we measure the success of that together? How can we measure the dangers of those gaps? And then who is accountable? Because we don't want to just point fingers. That's why Ola created Youth Connect, because we weren't just going to be an organization that pointed fingers. We were going to have a solution. But we still have to kind of look at the accountability across the board of this region, of these municipalities, of these school districts, this county, our state, and our federal government at the end of the day. So this is where we're at.
And Minerva, you had mentioned the school districts, and we had talked about something that was quite interesting in terms of some of the ways that you know, school practices can contribute to or the adverse impact of some of the policies and practices to the mental health well-being of youth. Can you talk a little bit about that?
I think some schools, it might be out of a protective impulse, potentially protective of the youth, protective of their teams as well, because we know that everyone working in schools they've got a lot on their plate, and we recognize that. But we do see that sometimes we have a RAC card that allows for our helpline, again, to be accessed 7 days a week from 9 a.m. to 11 p.m. in English and Spanish. And that RAC card should be everywhere. We found that in some districts, they only want to place this in the school counselor's office. So again, if you're creating a barrier so that someone has to come knocking on the door and other folks have to watch them knock on that door to come in to simply get that RAC card, you are denying them that access. They need that to be done in the safest, most confidential way. That should be in locker rooms. That should be in bathroom stalls. So we see that some schools want to kind of control, there's a lot of control elements that I know might come from good places, but they really do get in the way. The other area is that when we're having some of the conversations with even middle schoolers, we need to be able to have conversations that are real and appropriate with middle and high schoolers, but we often find that the minute that we even here's an example, and this is a perfect example, but we were doing something where it was kind of a tell me more segment where we're in with 25 kids, and we'd be talking about the fact that we're here for you, you reach out to us, whatever the workshop was, and then we would give them a little blank piece of paper and we'd say, tell us more. What's going on in your environment right now that you think would be important for us to know? What's meaningful to you in a good, bad, or otherwise type of way? And don't put your name on it, but write it out and just fold it up and hand it back up to us. And then we would sit in our cars right after our workshops and read through some of these. And some of them really were, concerning, but it was giving us a kind of a nice flow of really what is this middle school contending with, getting things off their chest that were definitely cathartic in nature. Like no one knows that I had an abortion when I was 12 years old. No one knows that I do self-harm right now. And a variety of things. And some of them were very positive things, but they were getting things off their chest. And that part of our workshop was cut short by a couple of different districts that just didn't want us to ask they didn't want any students to write anything down about their lives or what they were feeling or anything like that. So it became very clear that there's so much fear that institutions can have on how they're doing, that in this kind of inverted way, there is a harm there, because you're not letting students at least voice what they're going through, to not say that's your responsibility to fix every single one of those concerns. They just wanted to share what they were going through. And it does allow us a way to kind of fold in other aspects of our workshops to kind of handle some of these things that we're hearing. So that's one example that we're still working on. So as we build our trust and our relationships with our districts, we want them to see that we're not looking for gotcha moments. We're not looking for moments to say, hey, this kid had a really bad time. How come you didn't fix that? How come you didn't help them? The school districts almost have to be dealt with in a way that allows us to understand their psychology, one district at a time, so that the pain that they might experience is something that we can then kind of fold back into, that we don't have to give that pain right back to our youth inadvertently. So these are some things that we contend with.
Thank you. And now, John, from your lived experience, what are some of the best practices to addressing some of the mental health needs of immigrant youth or youth living in more rural or semi-rural communities. It's not often that we hear the perspective of a young person. So I wanted to give you the opportunity to share some of your thoughts on this.
Yeah. I think, and again, like Youth Connect is honestly providing so much of like a response like to these dire needs, like to these issues that we're all trying to address for immigrant youth. But one thing that really comes to mind, especially being first gen, our unique experience of being born and raised on the east end of Long Island, is just the inability to talk to like a community, like, mental health, like service provider, or just a therapist, counselor who's culturally competent enough, or at least identifies and shares a similar cultural identity, that could actually relate to you, that could relate to the patient. One thing that I've honestly often struggled with is like, how do I find really like, like a therapist or something, or someone who can be there to talk. There are plenty of services on the east end of Long Island, but we have to also think about their sliding scales and their rates. Some of those sessions can go for up to like $200 for 50 minutes, not even an hour. Sliding scale could go as low as 120. Being able to pay for that like multiple times a week, it's already inaccessible, and that it's only really able and catered to like wealthy patients, people who have the money and the funds to be able to pay for that, to afford it. So I think a lot of students, and including myself, like might honestly be looking to not even find a therapist, and to just kind of sweep any mental health issues that they're dealing with, any dilemmas that they might be facing, a crisis that they're dealing with, and just sweep it under the rug and just say, I got to keep moving forward. There's no one really available to talk to. On top of that, I think one thing that I've recently learned actually for a mental health training thing was cultural stigmas, and being able to develop conversations and discussions, maybe preferably like outside of the classroom, maybe, but with trusting adults, like who also might identify as Latino, who are bilingual, able to do these discussions, workshops in English and Spanish, and talk about the hard topics that honestly, like we could probably, and I say we as in like, immigrant youth, like could never really talk about like in the house at the dinner table, when it comes to generational trauma, and trying to talk about like, thinking about like parents, for example, they must have experienced mental health issues like when they were children as well. Maybe they didn't have the strategies or the resources to really handle it at the time. And so as adults, they carry that with them. And Minerva kind of mentioned it, but it leaks. It transfers to youth and ends up becoming their problem as well. So to be able to have like a safe space to have those like hard conversations, to talk about like first generation problems, the pressure to assimilate, the pressure to learn in English, learn English, and sadly, Spanish isn't really used that much on the East End. Like more and more it is being used. Some resources, governments are trying, but it's not enough. And I think it also reflects with immigrant youth, where most are only English speaking, barely Spanish speaking. And just overall, like that's let's see. And yeah, it's one thing that Youth Connect is honestly really trying hard to work at. That's why I joined, for me to be able to relate to immigrant youth, of like having to deal with some of these issues and not having anyone to go to. That's something that I hope to like, give back to the community. So
Sophia, may I share something that we're actually doing that kind of relates to what John is saying, if that's all right?
Yes, please.
And also one of the reasons why John was hired specifically, even though John had worked with Ola a few years ago, pre-COVID, it was wonderful to know that he would be able to come back to us for a little while. But John, as an intervention specialist, there's a grant that we're taking on that's going to allow us to work directly with families of youth that have kids between 13 and 16 that may be finding themselves sort of in this balance point of maybe getting a little in trouble with school. Maybe they had a vape that was found on their person or something like that. Nothing too extreme, but kind of in that kind of crossroads area, so that we're going to be able to work. And this is only Spanish language, a Spanish language evidence-based intervention, where we can work directly with families, in particular school districts that we choose because we've got a lot of partnerships. But so that way, the fear that is often felt by caregivers if a student is in a little bit of trouble, as a lot of teens always find themselves in maybe a little bit of trouble, but for an immigrant household, that can feel like the end of the world. The moment that the institution is now involved in your life is a very different thing. Lack of language access, everything gets taken out of proportion. Suddenly other institutions are involved. It's not good. So we're trying to create a way so that we can kind of simultaneously instruct and guide our school districts on ways of handling some of these matters that are very culturally sensitive and sort of tuned in to the needs of our families, and therefore supporting our youth in a better way. The other big thing that we're doing, that John is a part of just by being part of the Youth Connect team, and that we're all doing, is we're going for a New York State waiver that's going to allow us to be able to offer ongoing therapy, not in a clinical form where we're dealing with diagnosis or medication prescriptions or anything like that, but it's a level of being able to work that is more consistent, that will allow us to expand out more support of the families and the adults that are part of the lives of these youth. Because as we take our helpline calls, we see that so much, we kind of clock every issue that's coming through to see, where we're kind of guiding, seeing these trends. But there's almost not one conversation that we have that doesn't include some element of a relationship to family that doesn't have good communication, or a little bit of fear, or a little bit of anger, or a little bit of withholding. So if we can have this kind of stepped up connection to the adults in these families, and we can do that fully and freely, and then be able to, get the funding for that as well, we're going to be in a different state where we're really kind of addressing youth in the full scope of the mission that we do have. But that waiver is a big next step to that. And it's not just sort of a cultural understanding of our families, but a regional understanding. We know what people are going through out here. You can't have a national text line that has an understanding of the East End of Long Island. You can't even have an understanding of the East End of Long Island if you're in Western Suffolk. It just doesn't work. So we are going to bring that to the table with this when we get this waiver. I'm thinking positively, so that we can offer this to our communities and our youth.
Great, thank you. And I would like to invite members of our audience to go ahead and send along your questions. I wanted to pose a question that came in through the chat. And how have you dealt with difficult conversations, such as mandatory reporting, expressing suicide ideation, and CPS involvement in this work?
Sure, I'll speak to that. So from the very beginning with Youth Connect, we started Youth Connect directly after a prolonged relationship with Office of Mental Health, because we took on Project Hope. So Project Hope is a FEMA-funded an offering for communities that have been hit hardest by disasters, and Suffolk County had very high mortality rates during COVID. So when we saw that possibility was coming out, we kind of didn't think that we should be the ones to do it necessarily, because we're pretty small, but we realized that it wasn't going to happen if we didn't do it. So we stepped up, we got that grant, and at one point we had hired 23 people to cover 2 different teams, speaking English, Spanish, Portuguese. There's a small Portuguese speaking community out here, African American, Shinnecock, Indigenous, white. We built a team that needed to be built for emotional health support across our entire region, with not just a Latino focus. So we did that, and it was supposed to last 6 months. It lasted 2 years. So over the course of that, we were able to have really long and involved conversations with Office of Mental Health, and really understand kind of where we would build this out to with Youth Connect. When we did that, we also reached out to our local law enforcement agencies, our school superintendents that we work with most closely, to talk through some of the protocols so the 3 main areas for us are suicide, students wanting to harm other students, and active sexual assault. These are sort of the 3 areas. If those conversations are happening, let's say on the text line, those are areas that we are going to do everything we can, and we will break that confidentiality. We also let students know that when we give our presentations at schools, these are the areas that are most important. Job is going to be to keep everyone safe, and that's what we're going to do. So during those times, we are going to do what we have to do, either to connect them to law enforcement, to connect with law enforcement if we feel that something dangerous is going to be happening in a particular school district or area or home. We have in the past been able to work directly with a school to get a wellness check happen with a student who was emailing us that he didn't want to live anymore. So we were able to do that through the connection between our local law enforcement in that town and also the school district, and then maintaining communication with the dad, who at first was upset. He was kind of angry that law enforcement came to his home, but we felt it very important to maintain a relationship with the dad for him to understand what his son was actually going through. So his son wasn't going to get punished for the fact that he was reaching out for help, but we could not sit with that information and not do something about it. In terms of mandated reporting, if there's something, so that kind of addresses some of those things. If there's a sexual assault that's happening, then we're going to be doing everything we can to make sure that that student is safe. Our mandated reporting button is not the same as a school. So if a student is reaching out to us and we might be inferring that there's self-harm going on, or that they in the past have felt suicidal, or we're not going to take that and infer that into something else and immediately call everybody in. We are going to make sure that they have us to speak to in a way that allows them to develop that conversation. We are always going to be encouraging them to have other additional supports if we feel that that's the case. So we take it a little bit differently, but yet in those areas that are critical, we break every confidentiality we need to make sure that everyone is safe in that circumstance.
Thank you. And I want to pose another question that came in. And how do you navigate the reporting aspect with anonymous helplines?
Yeah, so if someone's reaching out to us on a text line and it is a block number, and when it shows up for us, we don't know what a block number is necessarily, because the only service that we really have is one that allows you don't really know, is what I'm saying. So if someone's reaching out to us and that we are learning that something dire is happening, in the case of the kid with the email, we don't trace IP addresses. We're not the FBI or the CIA. So in that particular case, we had to learn from the student what school he was in, or what areas, what was around his neighborhood, where he liked to go for fun with his friends. We had to sort of gather that information. In this case, I think he was pretty open with the school district he went to, so I think that made it easier. But in a case, if we did not know, we'd be trying to learn that information. And here's the reality. We might not know. We might not know. We might have a student that reaches out to us that is about to do harm to themselves. They might be calling or texting from a blocked line. In that moment, we're going to have the opportunity to connect them to the support that they need, either through a suicide prevention hotline that we can do a 3-way call and get them connected to that. We're going to have the opportunity to support them and be there for them and let them know what else is going to be out there for them to support. And if they hang up that phone and do not call us back and something horrible happens, we have to be able to live with that. Because if we're not out there, at least offering what we're offering, that student has nothing. If they were not able to reach out to anyone else, if they had no one else to go to, and this is the only moment and the only way they're going to do it, it is our only opportunity to help. And not offering that, to me, is a great disservice and almost a crime. So that's where we stand on that.
Another question for you. Are there programs that you know of like this in upstate New York? We have a number of participants in the audience who are from the upstate region, and Syracuse is a very resource-rich community. However, many of us extend our services to the more rural areas surrounding us. Any thoughts on that? Any suggestions or tips?
I think a lot of what we're doing with Youth Connect right now, and kind of even with OLA as a whole, is developing a model that aspects of it may or may not work in other areas. But I think some of the issues around isolation and being in a rural community, I think some of what we do and how we approach it, I think could be applicable. I know in upstate New York, you probably have similar scenarios where maybe a few more school districts or maybe a few more municipalities or village police departments. Sometimes that's a little bit difficult to overcome, but I think those relationships and how they're built is super important. And I'm sure you're all doing that. I think with Youth Connect, what we're seeing, there's no easy answer, but it really is drilling into these relationships, really taking the time to develop the trust of each of these school districts. And for us, there are 24 school districts. Not every one of the school districts has a middle school or a high school. So, but we're looking at each of those districts as we develop, because as we move forward, as the student gets older and older, we want that trust to be there. So I feel that developing something like this might not be feasible for every organization, because you do have to have a team that is ready. We answer a text or a phone call within 2 minutes. That is our promise, and that is what we have done. If we get busier and busier, we will hire who we have to hire. We are not going to go back on that promise. So it is having that availability and working with schools so that it's understood that our reason to exist is not to siphon off students from existing networks that they have within schools, but to make sure that we can be either a bit of a buffer or that in-between space. And I think really working with schools has been important, and also working with maybe existing nonprofits or mental health agencies that might exist in your region to find out really how are they fulfilling this need? What is that need? If you do have 20%, 30%, 40% Latino student body, and what other languages are spoken or other cultures are within your communities, to really ask the hard questions. How are mental health agencies? How are hospitals? How are crisis organizations dealing with the language and the culture? And to then sort of build out from there. You might not take all of it on, but maybe you take on the most critical gaps. But you do that in community and in collaboration. We can't do what we do alone. We've had to take on a lot, but we do feel that we've had support, such as with NYHealth Foundation, thank you so much, and to other organizations as well. Some of them, I think, on this call, I think Cabrini as well. But we are, we're lucky that we've had some of that support, but really it's such a local approach that I think, as you'll see in Westchester or Syracuse, that some people aren't necessarily awake to the needs that you have in your rural area. When I meet with leaders across New York and even into Albany, it takes me a while to explain why there is such a why this deficit matters so much. Why such a rich area of the Hamptons is absolutely the worst kind of combination for isolation and an exploitation, and how those needs kind of combine up in this perfect storm of, when you have lack of mental health access, what that actually means in a region like this, with money and such a power imbalance and the damage that does. So, you have to speak this narrative that has to be real and hard, and also somehow offer some solutions, at least the beginning of solutions. So that's what we're trying to do.
Great, thank you. So, one last question that came in, and I think this is, I'm sorry, it's not the last question, but I would like to make sure that John and Minerva, that you have an opportunity to, share one final bit of information or talk about what's in store for the future of OLA.
Well, I'm going to hand this one off to John. And John, if you would, I mean, it's part of Youth Connect, it's part of OLA, but it really is something that John and 2 other young people have founded just recently. And it gives me such a feeling of positivity for the future. And John, if you would talk about Latino young professionals.
So I recently got to work on a project with 2 other first-gen Latinas. And honestly, this really does touch a little bit on mental health support and being able to meet the needs of a community that's navigating life as a first-gen for the first time. So I created a group called Latino Young Professionals of the East End. We call it LYP. I co-founded it with one student who was the first Latina valedictorian at East Hampton High School, and she's currently going to Yale. And then the other co-founder is going to Johns Hopkins, hoping to get her PhD and go to grad school. So this group is made up of young professionals, essentially. It's dedicated to professional development, networking, and academic support as well. So, the 3 of us experienced, the college applications for the first time. How do we find volunteer experiences, internship experiences? These are problems that honestly are high stress problems, like high stress issues. We're trying to figure it all out for the first time. We can't rely on our parents or maybe even our own, personal network to really support us. So this group essentially meets that need of those in dire need of support. And, right now we're having members as young as 17, juniors and seniors in high school, current college students, and then people like myself, like, you know, who are like young people who are entering like their career for the first time, recent post-grads from college. And then we also have members who are current grad students and then seasoned professionals. So it's an interesting group. We have about 70 people who've joined, and it's only going to continue to grow. We had an amazing launch event a couple weeks ago and great turnout. And we're just really hoping for the best with this group. I think it's really meeting a need that a lot of younger folks who identify as Latino, who are immigrants, needed for a long time. And one of the themes of that event, you know, me getting the chance to greet everyone was like, why didn't this exist before? And I wish it existed when I was younger.
Mm-hmm. Thank you, John.
So we don't have a lot of time left, and there have been a couple of other questions and comments. I encourage folks out in the audience to reach out to Minerva and John if you want to share more information about the work that you all are doing and make connections that way. But we did touch on several themes during our conversation, very relevant to the work of a number of organizations on this webinar. You highlighted the value of cultural alignment in program design, the benefits of person-centered approach to mental health, and then also the importance of systemic reflection and reform around policies or practices that can be contributing to the generational trauma and can have detrimental impact on the health and well-being of young New Yorkers. So thank you again, John and Minerva, for joining us today and for sharing your experiences. And then also special thanks to Erica Van Boxtel for her work behind the scenes. A recap of today's session will be sent out shortly. Stay tuned for more events and briefings from the New York Health Foundation, including a third installment of our series looking at data about adult mental health trends and 2 upcoming conferences in the works. One is on veterans health and another on healthy food systems. So please feel free to visit our website for more information. Thank you, everyone, and enjoy the rest of your day. Take care.